My name is Josh Pearson, and I'm a registered nurse here at CHS Blue Ridge. I'm part of the medical team that take care of patients by the bedside and help them with their path to better health. Day in and day out as a registered nurse, I help patients by the bedside. I make sure they're comfortable. I ask them if they have any needs. I help them with going to the restroom or turning them, getting up and walking around the room. I help them with the medicine, and also, I'm an advocate for them as well too. If they have a problem, I get the doctor on the phone or respiratory on the phone and make sure that their issues get taken care of. CHS Blue Ridge, it was an easy pick for me because it's always been, I grew up here. I grew up from Burke County, and it's always been a part of this community. And I wanted to serve my community because I know a lot of people, and I just love being around people. And what better place than a hospital to work and serve your community. I actually graduated from East Carolina with a computer science degree, and I knew before I graduated that it wasn't for me because I wasn't in front of enough people. And I went into medical sales, and that put me in front of people, but it just wasn't the type of people I wanted to be in front of. And visiting nursing homes, I got to see patients at times, and I just felt like I wanted to be closer to patients. In the back of my mind, nursing was always there, always, something that I always questioned. And when I got a little older, started settling down, I figured that I'd give it a shot because I didn't want to, grow old one day saying that I wish I would have. Nursing, I have to be honest, was the hardest thing I ever done in my life. It was harder than my computer science degree. It was harder than anything that I have dealt with in my life. It's one of the things I'm really proud of, because of that hardship that I faced. It helped me mature as a man. It helped me with priorities. It was times that I had to miss out on things, miss out on ball games, miss out on cookouts, and and my family understood that. To me, I think to be a great nurse is number one, you got to be able to communicate with your patient. So to me, I always try to develop a friendship, a communication, therapeutic communication with my patient. I try to get to know them. I make sure that I ask them questions about themselves, so to show that I have an interest in them and I want the best for them. Whenever you're doing bedside report right before you go home, and your patient looks you dead in the eye and reach their hand out for you to shake it or to give you a hug, and they thank you, and they look you dead in your eye and they thank you for the service that you provide for them. And they also asked if you're coming back the next night, because that patient wants you as their nurse. And one of the best feelings that I have is when I come in the next night and I see the family member, and I come down the hallway and they ask me if I got their mother that night. That makes me so happy in the world. And also when I walk into a patient room and the patient says, "There go my boy," and that's just a great feeling. That lets you know that you've done your job.